Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about breastfeeding. Last week was Breastfeeding Week internationally, but we are a week late. Now, we are mammals. That means we are animals who have mammary glands. These mammary glands are present in the women from birth and they start developing as the child grows older. Finally, when they are pregnant and they deliver a baby, the mammary glands start to secrete milk, and this milk is the food for the baby. During the first few days, the milk is very thick and yellow and doesn't look like milk at all. So some people just express this out and throw it away. That is very unfortunate because that early milk called colostrum is full of antibodies and immunoglobulins and is easily digestible for the immature intestine of the baby. Breastfeeding should be a seamless, trouble-free process, but unfortunately, interference from the bystanders makes it very difficult for the mother. The preparation for breastfeeding should start during pregnancy itself. As soon as the baby starts to feed, the nipples can get cracked and painful, and then the mother becomes reluctant to feed. To prevent this, either coconut oil or baby oil should be taken, and the breast should be massaged, and the nipples should be massaged with this every day till the delivery. Then you should not feel that my milk is not enough and then try to squeeze out some milk and see if there is enough milk. Milk is produced in what is called a let down reflex, which means that as the baby sucks, signals go to the pituitary and the correct amount of milk is secreted for that baby at that time. Mother's milk is formulated to be easily digested and is the best milk for the baby. Similarly, cow's milk is best for the cow's baby, the calf, and donkey's milk is best for the foal. So we should not try to give milk from other animals to our children because genetically our milk is modified to be best for the baby. The secretion of breast milk is a letdown reflex. The more the baby sucks, the more milk will be formed. It is not possible to produce more milk by pressing and expressing. It has to be suckling from the baby. Also, when you breastfeed, you have to remember that the milk is always available, it is always at the correct temperature, and it is always pure. If you don't feed the baby and you decide to give cow's milk or formula feeds, whenever you travel or go anywhere, you have to carry a whole lot of things with you to sterilize the bottle, to heat the water, to dissolve the milk, and there is always the danger of diarrhea. If a baby is breastfed, it is less likely to get infections, ear infections, diarrhea, and it is also likely to grow correctly because the milk is always produced in the correct proportion for the baby's needs. In order for a mother to be able to produce enough milk, she should be encouraged to breastfeed. She should be in a stress-free environment. She should get a good and nutritious diet. And most important, she should hydrate herself. 1 cup of water should be drunk before feeding and 1 cup of water after feeding. The position for feeding is very important. Do not try to feed a baby in the lying down position because then the milk can go into the ear. The mother should sit upright and should keep the baby at a 45-degree angle in order for it to be comfortable for both the mother and the baby. Sometimes the mother gets a cough or a cold and then everybody says, don't feed the baby, you will give the infection to the baby. That is not strictly true. If you have a cough and a cold, wear a mask, and also your body will produce antibodies to this disease and those antibodies will pass on to the baby. Mothers are sometimes put on a very strict and tasteless diet saying that the baby will be affected. Only if you eat a variety of foods will the baby also get used to a variety of flavors and tastes and later on will eat well and feed well in life. Also, the only thing that is directly passed through the breast milk to the baby is artificial coloring, chemicals, and antibiotics. If the mother is being given antibiotics for some illness, then even if the baby gets some of it through the breast milk, the baby will become immune to the disease that the mother has and is likely to stay healthy. For the first 6 months of life, breast milk is the only milk that should be given to the baby. Sometimes the baby will start to cry and refuse to feed. The commonest cause for this is a blocked nose. If your nose is blocked, you cannot suck. If you cannot suck, you cannot feed. Then you will be hungry and you will cry. So, check first for a blocked nose. Second of all, babies are very sensitive to smell and they recognize the mother by her smell. So, if she suddenly decides not to have a bath or changes her soap or changes the detergent with which she washes the clothes that she wears, the baby is likely to refuse to feed or come near that mother. If a child is breastfed, it grows at the correct rate, is less likely to be fat, bonds well with the mother, will remain obedient and attached to the mother, is less likely to get ear infections and diarrhea. As for the mother, if she feeds the baby, will lose all the weight that she gained during pregnancy, and she is also less likely to get ovarian cancer or breast cancer. Sometimes people feel that their children are thin and so they try to give cow's milk or formula feeds, feeling that this is better and more nutritious for the child. This is not true at all. 100 ml of breast milk, 100 ml of formula, and 100 ml of cow's milk all contain the same amount of calories. Also, the breast milk is so beautifully made that the baby digests and absorbs it easily. And many companies and many industries have tried to replicate breast milk, but they have not succeeded. So far, nobody has been able to replicate breast milk in the factory. After 6 months, if the mother is going to work, then during the day you can try and feed either the expressed breast milk or solid foods and then continue to feed the baby all night with breast milk. As far as possible, continue breastfeeding till the age of 1 year. Stay fit, stay happy, try and encourage all the mothers around you to breastfeed. And if you liked what you heard, please subscribe to my Health Vibes channel and press the bell button. The same content is available in Tamil. Thank you.